Welcome to the MD Edge Daily News for Monday, July 30th. I'm Nick Andrews. Our top stories today: the CMS proposes site-neutral payments for hospital outpatient setting. The incident of heart failure is linked to HIV, and trial design is a problem for the promising Band 2401 results in Alzheimer's. But we begin today with an unmet need in skin cancer screening. Almost half of the individuals diagnosed with melanoma in a free skin cancer screening program would otherwise not have gone to a doctor to have their skin examined. This is according to an analysis by the American Academy of Dermatology's National Skin Cancer Screening Program between 1986 and 2014. The research was published in the Journal of the AAD. The program, known as SpotMe, is a national skin cancer screening and education program conducted by volunteer dermatologists that was launched back in 1985. In the study, researchers analyzed data from nearly 2 million people who were screened between 1986 and 2014. The program resulted in more than 20,000 diagnoses of melanoma, as well as over 150,000 diagnoses of clinical dysplastic nevi, over 30,000 diagnoses of clinical squamous cell carcinoma, and nearly 130,000 diagnoses of clinical basal cell carcinoma. Of those clinically diagnosed with melanoma, 83% said that they did not have a regular dermatologist, and nearly half said that they would not have seen a doctor for a skin exam if the SpotMe program was not available. Researchers also reported that 12% of those with a clinical melanoma diagnosis did not have insurance. That percentage increased over time to nearly 16% uninsured by 2010. And certain procedures conducted in the hospital outpatient setting could see a reimbursement cut to levels paid for under the physician fee schedule if a proposal introduced by the Centers for Medicare and Medicaid Services is finalized. The proposal to the outpatient payment system, known as OPPS, was released last week. In the proposal, the CMS would apply a physician fee schedule equivalent for the clinic visit service when provided at an off-campus provider-based department that is paid under the OPPS. According to the CMS, the average current clinical visit paid by the CMS is $116, with $23 being the average copay by the patient. If the proposal is finalized, the payment would drop to about $46 with an average copay of $9. The American Hospital Association is already pushing back. Tom Nichols is an executive vice president of the AHA. He says that this proposal demonstrates that the CMS is showing a lack of understanding about the reality in which hospitals and health systems operate daily. However, Dr. Farzad Mostashari says that the proposal could actually be a good thing for hospitals. Dr. Mostashari is the founder of the healthcare technology company Aledade. He was also the national coordinator for health IT under President Obama. Dr. Mostashari says that the truth is that this proposal could help hospitals be more competitive in value-based contracts or alternative payment models, and that they should embrace the changes. The OPPS update also includes proposals to expand the list of covered surgical procedures that can be performed in an ambulatory surgical center. You can find the complete proposal as well as further analysis by clicking the link in the description. People who are infected with HIV have a 66% increased rate of developing heart failure independent of any other cardiovascular disease risk factor. This is according to results from nearly 500,000 people in a large U.S. healthcare system presented at the 22nd Annual International AIDS Conference. Dr. Alan Goh is the director of the Comprehensive Clinical Research Unit of Kaiser Permanente in Oakland, California. Dr. Goh spoke with MD Edge at AIDS 2018 in Amsterdam.
I believe there's really two primary messages here. First of all, I think there has to be greater awareness of the importance of the risk of heart failure in people living with HIV, even on excellent treatment. And that means paying attention to potential symptoms that may be related to the syndrome of heart failure, prompt evaluation, and then of course standard treatment for heart failure if it's diagnosed. I think the second issue is to pay attention to the cardiovascular risk factors that contribute to heart failure. As you mentioned, the importance of controlling blood pressure, also controlling diabetes, preventing smoking or helping people get off smoking, and also treating things like obesity, and importantly treating high cholesterol.
You can find the entire interview with Dr. Go by clicking the link in the description. And finally today, questions are swirling around recent research regarding the monoclonal antibody BAN2401 and its effect on Alzheimer's disease. The research was presented last week at the 2018 Alzheimer's Association International Conference in Chicago. The Phase 2 research appears to show that BAN2401 slowed cognitive decline by up to 47% while clearing brain amyloid in 81% of patients with mild cognitive impairment and very mild Alzheimer's disease. At AAIC, the developer of BAN2401, Eisai, touted the study results as an important step forward in a field that is desperate for a breakthrough. However, the trial design is now in question. Specifically, the unequal distribution of patients who were positive for apolipoprotein E4 across the 6 treatment groups. The 6 treatment groups consisted of 5 different dosages and regimens of BAN2401 and 1 placebo group. Indeed, patients with apolipoprotein E4 comprised about 70 to 80% of every unsuccessful arm in the trial, but comprised 29% of patients in the arm of the trial that conferred significant cognitive benefits. Dr. Keith Fargo is the Director of Scientific Programs and Outreach at the Alzheimer's Association. Dr. Fargo called the distribution a big confound. According to Dr. Fargo, for a period of time, a regulatory body requested that people with APOE4 Alzheimer's risk gene not be included in the highest dose group for safety reasons. Because of this, the people in the highest dose group are different from people in the other groups on an important dimension. They were much less likely to have the APOE4 gene, which is known to be a major risk factor for cognitive decline. So it is plausible that the people on the highest dose declined differently due to genetic differences rather than due to being on the highest dose. Dr. Fargo also says that a planned subgroup analysis will shed more light on this and that those analyses are eagerly waited. As a publication of this report on July 30th, 2018, MD Edge has not received comment from Eisai. And that concludes this edition of the MD Edge Daily News. You can find links to these stories in the podcast description. The Daily News is published every weekday at 4 a.m. Eastern Time, so you can make us a part of your daily routine by subscribing wherever podcasts are found. For MD Edge, I'm Nick Andrews.